Thank you. Hey, welcome. Hey, good afternoon, and welcome to the Thurston County Board of Health Board meeting for June 11, 2019. I'm John Hutchings, and to my right is Commissioner, I guess, co-chair,
Vice Chair,
Commissioner Ty Menser. To my left is
Gary Edwards.
To his right is the clerk of the board, Lydia Hodgkinson. And to her right is the Public Health and Social Services Director, Shelley Slaughter. To her right, in the middle, is Dr. Rachel Wood, our County Health Officer. And to her right is Ramiro Chavez, the County Manager. So thank you all for attending. And the first thing we're going to do is approval of the agenda.
Move to approve agenda dated June 11, 2019.
Second.
Been moved and seconded to approve the agenda. Any additions or deletions, changes?
No, sir.
Okay. All in favor, say aye.
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 Aye. We have an agenda. Approval for the meeting minutes.
Move to approve meeting minutes from May 14, 2019.
Second.
Moved and seconded to approve the meeting minutes from May 14, 2019. Any corrections or comments?
No, sir.
Okay. All in favor, say aye.
Aye.
Aye. That motion carries as well. Takes us to item number 2 on the agenda, opportunity for the public to address the board. And let me just see if anybody has signed up, perhaps. Let me just see. Hang on. None. Okay, if anybody changes their mind, oh well. Moving on. Agenda item number 3 is acceptance of the Board of Health work session summaries.
Okay. Go ahead and make a motion to accept Board of Health work session summaries for March 5th, 2019, March 12th, 2019, April 2, 2019, April 9, May 1st, May 7th, May 14th, and May 22nd, all of 2019.
Second.
Been moved and seconded to approve all of the Board of Health work session summaries, March through May. All in favor, say aye.
Aye.
Aye. That's done. Agenda item number 4. This is the 1-year update on our homelessness as a public health crisis. And we have Keely Marino coming to the stand, our Homeless and Affordable Housing Coordinator. Welcome, Keely.
Thank you. Keely Marino with Public Health and Social Services, Homeless Prevention and Affordable Housing Coordinator, and it is with great pleasure and honor that I get to present to you today an update on the declaration that the Board of Health declared last year on homelessness being a public health crisis. So, and I have a clicker, and I'm going to use it. I've never used this clicker, so this could be very exciting. Nope, wrong one. How do I do it?
Okay, that was fascinating.
Wasn't it good? We've done so much. Help me, Lydia. Help me. It's my error. Oh.
It's my fault.
Oh. Oh. Is it that?
And hold on, it needs to plug it in.
Oh. So anyway, the other day I was saying to
That's turned on the side.
this is off to an excellent start.
Keely Marino, everybody.
Yeah, here I am. All right. Says on.
Yeah, you got it.
Oh, look at that. Okay. So I broke this PowerPoint presentation into sections according to the declaration. Section 1 was just the declaration of homelessness, and I've included the graphic that was presented to the Board of County Commissioners, I believe 2 weeks ago, to kind of summarize the findings of this year's point-in-time count, to kind of call out where we are right now. Last year, 2018, there were 835 folks that were counted through the point-in-time count who were experiencing homelessness. This year, there were 800. That includes 394 unsheltered individuals, which is an increase from last year. However, it's always important to understand that the point-in-time count is almost invariably an undercount based on the definitions that HUD uses to identify who is homeless. The methodology is changing on almost an annual basis. And then also the difficulty of finding unsheltered individuals and count them on a nightly, one-night basis in a year. And also the high rate of refusal that folks that are experiencing homelessness can refuse. It's a voluntary survey. So oftentimes, or almost all the times, according to the National Law Center on Homelessness and Poverty, the HUD point-in-time count is an undercount. To that point, I was speaking with the homeless coordinator for City of Olympia last week, and they are doing a clicker count of just tents in the Olympia region, just tents. Tent can be one person, two people, three people. They had not gone to survey every camp at that point. There are three more that they hadn't counted, and they already had counted 400 tents just in Olympia. So if the number that we have for the point in time count is 394, yet we have more than 400 tents, that just points to a much bigger unsheltered population than the point in time count has accounted for. Also, something that is really important that we'll get to later is the colorful demographic. It may be hard to see, so I'll call it out to you. In Thurston County, in the general population, we have 18% people of color accounted for. In our homeless count, and these are only the folks that were accounted for through the point in time count, 32% of folks on the street or folks experiencing homelessness are people of color. So just hold on to that while we move on through the presentation. All right, Section 2, Board of Health declares support and solidarity with the City of Olympia. These are just some of the highlights of the activities that we've engaged in since declaring our support and solidarity of the other jurisdictions, including the City of Olympia, including all of us, I believe, helped with the point in time count. We contracted with City of Olympia to conduct that for us. We had held a summit in February. There's multi-jurisdictional meetings happening where I'm attending and other county representation is there, including the Board of County Commissioners. We've been working on emergency ordinances. We've been helping the City of Olympia manage and oversee the what do you call it? Not migration, I guess migration into the mitigation camp initially. And then we've had presence at planning commissions, Olympia City Council. There was a Tumwater Youth Summit. So there's been a lot of presence from the county in our county multi-jurisdictionally. And there are many other examples, but these are just some of the highlights. I'm turning the page. All right. Section 3, the Office of Housing and Homeless Prevention Partners. I'm, again, not going to read out every single one of these partners that are listed. I have them under Thurston County, in the municipalities, and then the nonprofits that are involved in our homeless crisis response system. This is just to indicate, this is, I'm sure, not a complete list, that what a robust system we have and our partnerships in our county. But within the PHSS, there's some highlights that of this year, some of the activities. The Office of Homeless and Housing Prevention funded Olympia Free Clinic to provide Hep A vaccinations for the 2018-2019 season. And there were 15 vaccinations administered to homeless individuals in 2018. In April of this year, the Office of Homeless and Housing Prevention contracted to increase the funds to provide Hep A vaccines to Valley View Medical Clinic that's placed within the Providence Community Care Center. So increasing access to homeless individuals to Hep A across the board. In our syringe exchange, data given to me between May 1st, 2018 and April 30th, 2019, a total number of syringes taken in, 1,460,581. Exchanging them one for one, 1,247,713. And disposals, like people just dropping them off, over 200,000. We've distributed over 1,800 naloxone kits, and there have been 246 overdose reversals reported to the syringe exchange. We've been engaging with solid waste and going out with them very recently to some unmanaged encampments in unincorporated Thurston County to make contact with those individuals. We've included the Greater Regional Outreach Workers League to come alongside solid waste, community planning, economic development, public health, and also the Sheriff's Office to go out and make contact with those individuals to ensure that they can get good referrals into services should they desire them. And then, of course, we just finalized our RFP process, and we have distributed or will be distributing in July 1 and in September 1 over $6 million to be supporting our current and current homeless system and also new capital projects for permanent supportive housing. So we've been busy. This is the only incorrect part of the presentation. That should be a number 4 instead of 5. I apologize. I just got that today. So this section is just your leadership, the Board of Health. These are not, this is a tiny amount of commissions and meetings that the Board of Health attends. And so these are just calling out a number of them that are specifically related to homeless and housing. Board of County Commissioners, of course, Community Investment Partnership that just was involved in distributing those $6 million, making those decisions. The Thurston Thrives Coordinating Council, the Opioid Task Force, who many of those members are here in the audience today. The Homeless Housing Hub, which is our local continuum of care. So we've got representation from all the providers. It's a requirement from the state that we have a local continuum of care, and we do. And then the Housing Action Team, and I broke them down into red team, blue team, green team, silver team. And so red team is homeless and housing. The blue team is affordable housing and the pipeline for affordable housing. Green team deals with landlord relationships, liaisons, and renters, and that sort of thing. And the silver team is for the aging population who are low income, who are at risk for homelessness, or who are currently experiencing homelessness. Flip me. All right. These are properly numbered. Section 5 and 6, this is around the Hazardous Weather Task Force. So the Hazardous Weather Task Force was formed in 2017 to address a need for consistent response to those who are in shelter during the winter season, above and beyond the already allocated shelter beds in our county system. It was a fantastic effort, the first of its kind, to come around the table and really talk about what we needed to do to respond to the unsheltered individuals during cold weather. All of the shelter providers were there, multi-jurisdictional representation from elected officials and staff, faith-based providers, as well as concerned community members. Since then, we've changed our designation of cold weather to be a season and not just based on temperature, which makes it consistent across the entire season from April 1 to November, or from November 1 to April 30th, and also makes it less confusing for those who need to access shelter. This year, for our season, which was, again, November 1st through April 30th, we had 43,817 bed nights. Those are not individuals. Those are all the beds within the shelters that were occupied. The average per night was 242. We were at a 14% over capacity for the entire season. Our shelters were full. They were very full.
Before you
Yes.
move on, may I ask a question? Do you have an asterisk by the system capacity per night?
Yes, I do. I do have an asterisk there.
Okay, I just wanted to be sure I wasn't
Let me
seeing
give my brain a second to remind myself what that is.
Or you can continue on and get it at the
Yeah.
end. Thank you, Keely.
Oh, yeah. All right, so just to highlight some of the Code Blue activities. So Code Blue is a function of the Hazardous Weather Task Force with a hazardous weather response plan. And the Code Blue this year was phenomenal, as we all remember. We had a 3-day event at the beginning of the cold weather season in December, and then we had our 12-day event that happened in February. And so these are just some of the numbers accumulated during that time, during the entire season. So during the entire cold weather season, we had 536 extra beds on top of the average of 242 per night. Just for Code Blue during that whole season, or that whole I guess event season, there were 2,747 bed nights just for those very extreme cold nights, and volunteer hours, tons of volunteer hours, mostly in the shelter. But this year was unique because it was the first year we offered sheltering in place during Code Blue. And why we did that was because the mitigation site was just one of the camps, the unmanaged camps in our county, where people were choosing to stay with their belongings and choosing to stay in their tents. They did this for multiple reasons. They were afraid if they came into services, something bad would happen or their camp would be cleared. They didn't want to leave their beloveds. They didn't want to have to choose between their service animal not being able to stay with them, or just a lot. There's multiple reasons why people were choosing to stay in their tents during that time. And so the City of Olympia played a big role in that, and we went out and decided to buy survival gear, just a few things, blankets and water bottles, hand warmers, socks, and during the Code Blue season, we used intercity transit vans. They were so kind to offer us use of their community vans to go out in teams of 2 to distribute these items. So these are some of those numbers that went along with that sheltering in place. 270 contacts, 1,400 survival items, 24 rides provided, and then 39 outreach hours. And that was such an amazing coming together of providers and city staff. We intend to continue those activities, and I'll get to that later, including hot weather season. So when the smoke season arises, we're hoping to distribute survival gear to folks who are outside who are perhaps medically challenged. Then there comes me. So you wanted to hire a homeless response coordinator, and you did. You posted it in the fall of 2018, and in January 2nd was my first day here on the job. So here are a number of the activities I've been involved in. Many of them I've already mentioned. So if you'd like, I just pull out some highlights. I'm working currently on the 5-year plan. If you remember, last year, June 14th, 2018, you also approved the 5-year plan, and surprise, we get to rewrite it, which is very exciting and a surprise for me. And it has been a tool of bringing together law enforcement from all of the various agencies to discuss the 5-year plan and get their input on how do we actually respond to homelessness. It's been an opportunity for us to bring together staff from all the jurisdictions to have conversations around how would they suggest responding to homelessness. Each of the homeless subpopulations, youth, young adults, families, single adults, we are getting together on an individual basis, and then we have a core team that's working on the 5-year plan. I'm also joining efforts with the City of Olympia. I meet with them on a weekly basis so that I can help them. We can make sure that the 5-year plan is informing their homeless response plan, and likewise. So last night, I got to go down to the community care center. I had the distinct privilege of going to the listening sessions down at the community care center where they had folks that are currently experiencing homelessness, not in Plum Street Village, but on the streets, in the encampments, coming to the Providence Community Care Center, and I got to hear their ideas on how they would like to, or how they would respond to homelessness. And the questions were, what's working, what's not working, and if you were mayor, what would you do? And I heard some of the most brilliant ideas last night from a rabbi who's a photographer, starting an art center downtown, so for people having an outlet for their artistic endeavors, and all sorts of really interesting ideas about community housing. It was really fantastic. So really enjoying the process of writing the 5-year plan. It's been so helpful in a regional response, which is what we all want, is a regional response. So there, I have them listed. If you have any questions when I get through with my presentation, I'm happy to expand on any of those listed. Okay, addressing the underlying causes of homelessness. Again, here I want to call out that nationwide, it is a known statistic that race is a main proponent. People of color are overrepresented in homeless populations across the United States. And that is true for our county as well. And there's that statistic, 18% of the general population versus 32% of homeless population. Many people are aware that 40% or more of homeless youth on the street are LGBTQ+, and that the number one factor of them being on the street is family rejection or fear. We also have a 32% vacancy rate, or 3.2, not 32, because that would be amazing, and my job would be easy. So 3.2 vacancy rate in Thurston County, with a 15% increase in rental prices since 2016. And there's a statistic that came from the Department of Commerce that stated if for every $100 increase in rents, it results in 15% increase in homelessness. And since 2016, rents have gone up an average of $200 to $300, or $200 with that's a 30% increase in homelessness, which is reflected in our point-in-time count, because in our point-in-time count, the number one leading reason that people identified for being homeless were evictions. Some other interesting information is in the OSPI homeless student demographic count, 2017 to 2018. 1 in 10 of Thurston County 8th grade students are 10% are Native American who are experiencing homelessness, with a much smaller general population, or 16%, excuse me, and Latinx or Hispanic folks, young people, 13% homeless. The North Thurston School District has 27% representation of homeless young people who are Latinx and Hispanic, but that Latinx people in the North Thurston School District or children only make up 5% of the general population. In Yelm, the children experiencing homelessness are 22%, which is only 2% of the general population. So 22% Latinx children experiencing homelessness in the Yum School District, but only comprising 2% of the general population. So you can see race is a significant driving factor in root causes of homelessness, and one of the main focuses that we are working with in writing the 5-year plan with our considering our homeless crisis response system. So up here we have the methods that we're addressing the underlying causes of homelessness. In the 5-year plan, the Department of Commerce has put forth initially only 4 guidelines for local continuums of care to address in their local plans for addressing homelessness in their homeless crisis response system. In April, they added a 5th. And that 5th guideline is to address racial disparity in your homeless crisis response system. So in the little bubble below that is the Racial Equity Research Team. We have a team here in Thurston County that's been meeting for over a year to come together and talk about disparity in prioritization practices and coordinated entry with regards to the vulnerability assessment tool. So we've been meeting for quite some time doing research to figure out what is our goal, and how do we in a meaningful way address the disparities of race and homelessness. The balance of state continuum of care, I was approached when I first started to chair the subcommittee on racial equity, and we've been meeting and addressing the same issues, but from a balance of state perspective. One of the things I'd like to put forth is cultural humility training for providers and the public, and so that is happening. And by that I mean, when you are training a system, or you're training providers, or you're training citizens on trauma-informed responses to vulnerable residents, you are addressing racism, and you're addressing these disparities. LGBTQ competencies for providers and for the community, and harm reduction. All of these trainings that are offered on a rotating basis for the community are happening down at the community care center. And so we are engaging in these trainings, and I'm hoping that as we move forward that will be a part of a regional effort, that we, the county, will find a way to make sure that those trainings are happening on an ongoing basis in perpetuity. And then, of course, the Thurston County Opioid Task Force is another way that we are addressing the root causes of homelessness. All right, this is a draft, but I've been mentioning this image that I've created, and actually Pam Gant from the TST team helped me put this together. So when I'm talking to the public, or I'm talking to anyone, and I'm describing my job in the situation that we have currently in Thurston County, I say, I'm on everyone's team. That's my job, is to listen to citizens and people experiencing homelessness, and providers and doctors and anyone who's got concerns or a stake in responding to homelessness. And I say, well, let's just look at where we are now. That number, 1,000, is an extrapolation. It's a give or take. But if we have 400 tents in just the Olympia area, that could represent double that. It could easily be 800. If you were walking downtown in Olympia in August of last year, or not August, but more September, October, you could find 394 people just by walking in the downtown area. It was easy to see that there were easily 300, 400 people in the downtown area. So extrapolating up to 1,000 isn't ridiculous. I think that it's pretty fair. But let's just say, for sake of argument, only 394 unsheltered people are in our unsheltered population are in our county right now. So forget 1,000, just see 394. Well, some of those people might be diverted, meaning they go through a diversion process and they end up in subsidized housing, or perhaps they're rapidly rehoused into subsidized housing, affordable housing, permanent supportive housing. Some people that enter the homeless system will go through coordinated entry, which is what CE means down at the bottom. And that might help them be prioritized into emergency encampments, emergency shelters, and continuous stay shelters. So continuous stay shelters are shelters where you have an assigned bed and you can stay, you have that bed guaranteed you, where emergency shelters are on a night-by-night basis. So in our current system, so those are our options for people who are unsheltered. In our current system, if we have 394 people and we have those emergency shelter beds that are full. They're at capacity. On a regular night, folks, during the hot weather, folks are being turned away at this point. So all of those sheltering options are off the table. And then with affordable housing and subsidized housing with a 3.2% vacancy rate in our county, finding affordable housing, much less low-income housing, much less permanent supportive housing, is very, it's very difficult. The wait times can be really long. And so we just awarded some money to some agencies for capital projects to build permanent supportive housing. And that permanent supportive housing is not going to be online until 2021. So we have 3 years between now and then for there to be more permanent supportive housing coming on board. So where do those 394 people go? Much less where do those 1,000 people go? I don't believe, since we don't, this is our system right now, like what are we gonna do to expand it? So I just throw this in there to do kind of a state of the union for where we're at. And if we, like looking at this image, all of the sheltering options are in City of Olympia currently. So just a little snapshot of where things are at. All right, what's next? Let's be cheery. Let's end on a high note. So here I have just kind of come up with some ideas of, and some of the directions that I am heading and where we're already heading and I'm anticipating us continuing. So some of the tasks we have ahead of us as a county is to understand intersections, to truly understand and address the impacts and intersections of racism and homelessness, and to create a meaningful and impactful response to this issue. That's one thing that we are working on right now, and we're going to continue to do so. Respond regionally. We're doing that. We are seeing, in my meager time, unprecedented regional response to homelessness. And I'm speaking back from my previous experience. In the last 10 years, I've never seen such a regional response. I may be wrong, but that's me. We're going to continue to support our cities, which we're doing by attending at their request meetings and planning commissions and just showing our support when we are asked. We need to address the concerns of our citizens. That is a really important part of a homeless crisis response system. The public are impacted. Absolutely, 100%. The folks that live in houses in our county are impacted by homelessness, and they have concerns, and it is my job and our job to listen to them. Exploring options, just getting really creative. We have to get creative. HUD is not going to fund us out of homelessness. So we've got to get really creative about how do we engage the private sector in this conversation? How do we think how do we go down to the community care center and get some really innovative ideas from folks living on the street? We just need to be, it's not business as usual anymore. The landscape has shifted. Strengthen our system, the one that we already have. Let's continue to support them. Increase data quality. Across the board, everybody wants this. Elected officials want this. Providers want this. The public wants this. So working on methods to really increase the quality of our data. So it gives us a really clear, concise, impactful picture about what's going on. Finalizing the plan. That's going to be significant because it's going to guide our funding decisions from here forward. Strengthen coordinated entry, which we are doing. There's been many changes, and we're moving to more of an outreach-based system to ensure that we're getting out into the county and gathering more folks into the coordinated entry system. Engaging the community, which is that community training. I was talking about how do we have what will be supportive to the community in terms of what education they want, what information they want, and venues for them to voice their concerns. Planning ahead, so this is for the Hazardous Weather Task Force. We need to plan for the upcoming season, which we're doing on Friday, and exploring the options of sheltering in place and what are the impacts of that and what does that look like going forward. And leading the way. So we have had a busy year, even though this is only 5.5 months of my time. The county has been busy, and it's evident by all of this fantastic information. So there you go. Thank you for your time. Any questions?
I would imagine there will be.
Sure. I'll jump to shelter. So I like the graphic because it kind of it puts things together in a way that I hadn't seen. So, and my understanding from what you said is that Lacey and Tumwater have 0 shelter beds.
Well, in cold weather, is it St. Mark's? There's a Catholic church, I can't remember right now, I'm sorry, but they offer 12 men experiencing homelessness beds, but their shelter season is shorter, and it's only half the time. They kind of vacillate between Lacey and Olympia.
Are there any plans for either of those jurisdictions to build shelters? I know there was some state funding for a new shelter. I don't exactly know where that's located.
Not to my knowledge.
Okay, and do we, like, what would the, so using your 1,000 number, which I think is probably low, but certainly reasonable given what we know.
Right.
You know, you hear that some folks would not, if there was shelter, they wouldn't choose to be there. They'd rather have, all the reasons you ticked off for not coming in the cold are reasons not to be there in the warm. So my question, I guess, is do we know how much shelter capacity, additional beds would be filled if they were available?
I believe whatever shelter is built, if you build it, they will.
Well, it wouldn't be 1,000, let's say,
No.
because we know that at least some people wouldn't want to go to shelter because there's rules associated or hardships with animals and belongings. But is it 800? Is it 600? Like, what would be an optimal number of shelter beds given our current state of affairs in your estimation?
I'm going to just make something up right now based on my own experience by running a shelter in this community for 5 years, that it would several hundred, 200, 300, well, 200, I would
Additional.
say easily.
On
Yeah.
top, it looks like we have 224
Yeah.
currently outside of the cold weather.
Yes.
So another 200 you feel would be a
And
target.
that weighs in on the Martin v. Boise conversation, because you can't, by that decision, you can't move folks from public land that are camping there unless you have a safe place inside to send them. So that might impact the number of beds that would be occupied, depending on the Martin v. Boise, like actions associated with Martin v. Boise.
Going to the affordable housing piece of this, and there's the blue team, and there's the model that I saw presented at least 5 or 6 times last year about how we could run numbers for developers to incentivize construction of affordable housing. Is there any, like, is that going anywhere? Are there any other action steps associated with that piece? It just seemed like it was presented, and I haven't heard of it moving forward.
I haven't heard any more since I've started. That doesn't mean that it's a dead issue. I haven't heard any more.
Kind of going back to the point in time numbers. So I'm curious, because I know you're saying that so we saw visually a bloom of tents downtown, and some people, there was some article I read that attributed that to the Martin, and that basically it wasn't a surge in homelessness. It was just people coming out of the woods and being downtown. That seems to be validated superficially by the fact that the point in time didn't yield any. We would have expected a tripling, right, because of what we saw in downtown, but we didn't get a tripling in the count. So that seems to validate that that theory that it was the same number of homeless that we've had coming into public view. Is that?
I think that's fair to say.
Is that fair, or is there a different?
I think that's fair to say.
Okay.
Yeah.
And because you say there's always an undercount, and that's always been true. And that would have been true in previous points in time.
Yes.
Okay. And
Part of that undercount also is that there were 40 less beds this season. Salvation Army's normal 40, 42 beds were not open due to construction. So this number would have been a little bit higher, would have been 840. Were those beds open? Just saying.
I'll let you guys go.
Okay. Go ahead.
Keely, you mentioned there were 246 overdoses. Were those treated and recovered? Did some of those not recover? Do you know very much about those 246 overdoses?
Yes, those are reversals. So those are folks that were experiencing an overdose and were administered naloxone and then survived.
Do you keep track at all on the length of time that they were out of it, unconscious, weren't breathing? Do you have any records about that at all?
I don't. That would be, and that's not my specialty. So
Okay.
I
No,
asked,
I
I
just
asked other staff to give me those stats.
I've heard presentations from others that say that after 6 minutes, there's kind of unreversible or irreversible brain damage or something.
There's
That's
so many people in the audience that can hop up here and answer that question, but it's
Okay.
not my specialty.
and you made some mention about the money spent on housing. I think that was for the small housing. I really didn't get that part of it. Do you have a dollar amount?
Which part?
Well, early on, it
Mm-hmm.
was close to the 246 on the overdoses. I was taking notes.
Oh, the amount in capital projects?
Yeah,
That's
what do
it's
we-
around 700,000, 750,000 that we were able to distribute.
Any idea what it's costing to come up with even the miniature house operation? What that costs
My
for us
understand-
to do that?
I'm going to be pulling up an image from my head from
Mm-hmm.
a budget that I saw, and that to construct Plum Street Village was around 400,000. So that's to set it up entirely with all of the structures and all the electricity and everything. So to set up that Plum Street Village was about 400,000.
You made some mention about $6 million or something that the county and the municipalities, I believe, have all spent. Is that right?
Yes,
Towards solving this,
That was the CIP.
the CIP,
on this whole housing
Yes.
problem, right?
yes.
Do we have anything about treatment, what it would take to have both mental health treatment and drug treatment imposed on these individuals after a certain period? I know we often hear, well, they don't want help, but is there any thought about pushing them after they've committed a crime or done something to show that they are not able to care for themselves? I don't know, commitment, something, so that we can come up with some way to treat these folks for whatever their problem is, whether it's drug addiction, mental health. Maybe it's a mental issue because of their prior drug addiction.
Right.
I really don't have the answer to that, but so that we can come up with an exit plan to get ahead of this at some point. Is that being considered?
One of,
And
so
how
one
we
thing,
deal with
one thing
this?
to also understand, and I wish Mayday Hogan was up here. One thing that's really important to understand is that all of that $6 million that we distributed to providers in the community to provide sheltering services, transitional housing, affordable housing, permanent supportive and support services, and build new housing, all fall under the guidelines of HUD and CHG. And under those guidelines, it is a requirement that all of those funds that are distributed go to programs that are low barrier. And by that, it means you cannot discriminate in placing them in any kind of housing program based on their usage, whether they are users of any kind of substance, and you can't require them to enter treatment under it. So all of our $6 million are needing to align with the guidelines brought down from the federal government and the state government. So that, in that model, that $6 million, no. And that's due to their understanding and definition of best practices in working with chronically homeless individuals.
In the past, we've been kind of a number that gets kicked around in this demographic is that 20% of these folks are from elsewhere and 80% are from here. I truly believe that 20% are from here and 80% are from elsewhere. And oftentimes we don't find that out as a fact until we have a police or medical interaction where we truly identify those individuals. And so at some point, we're going to have to get ahead of this program. We can't just keep enabling these individuals to come here from elsewhere, whatever it is. I think we could do a very good job dealing with our 20% if we could get it down to that 20%. So is there any any talk about maybe identifying where these folks are from? Get them a bus ticket home? Get them an airplane ride home? I don't know, it'd be way cheaper than the way we're doing things right now.
I think that every continuum of care, especially along the West Coast, has the very same idea and the very same kind of response. And part of, when you're talking about delivering services to people experiencing homelessness, a lot of the talk is, okay, so in this room, raise your hand if you were born and raised here in Thurston County. When did you arrive? When does you being here enough? How long is it that you need to be here in order to say that you are from Thurston County? So they're here, and we have these dollars to serve them. And so I don't know, I get kind of in that place of they're here. And so they're paying taxes through sales tax, and let's try to help them out.
I guess we'll never have enough, probably, to do everything we need to do.
Yeah.
Okay, I could go on for a while, but
Okay.
no need, maybe.
I'm looking at your last slide, what's next, and you started with increased data quality.
Yes.
You don't have to go to that slide, because I'm going to jump to the first one now.
Okay.
This pretty one.
Uh-huh.
And you mentioned that Olympia this year alone started counting tents.
Mm-hmm.
And was anybody else county or anybody else the county counting tents, or was it just Olympia?
No, this was a very recent activity that I wasn't even aware of until last Wednesday.
So they've established a baseline for 2019.
Yeah, absolutely.
Do they intend, do you know, I know you don't speak for Olympia, are they intending on continuing this practice then?
I would say yes. I meet, like I said, I meet with them every Wednesday, and so I've already talked with Colin DeForest to attend with him to some of these camps that I'm aware of in areas not within downtown Olympia.
And then will Thurston County's practice be to also count tents?
It could be. It
Okay,
could
we
be.
just don't know
I
yet.
mean, the point in time count is falling back on me. It's another one of my jobs this year. And so I'm considering all sorts of different methodologies that we can try to make consistent and how to spread the reach a little bit and also be creative around how we're actually going into encampments and counting folks.
Yeah, it seems it's going to be one of the most difficult challenges is going to be getting an accurate quality data.
Absolutely.
Because even the point in time when you count this many people, but the state only certifies this many, it's
Right.
not accurate.
Yeah.
And if you presume there's 2 per tent, which may be a safe assumption, it's not accurate.
Well, it also, the point in time count does not count RVs. So we have
Right, yeah.
nobody's doing that count right now, but should.
Okay, and so when you, I'm jumping to section 7, your revision of the Thurston County 5-year plan, are you doing that, again, in concert with the cities to make sure we're in alignment?
Absolutely.
Okay. And I thought, well, that must be it. I thought I had one more, but I'm done.
Okay.
Thank you, Keely.
Yeah.
Anything else?
I think that kind of covers it for today for me.
Thank you, Keely, very much.
Thank you.
Thank you. That takes us to agenda item number 5, department item, adopt the draft Thurston County opioid response plan. Oh, yeah. So we have Mariana Garo, our epidemiologist.
Thank you very much for having me today. And we're just going to pull up the PowerPoint. I have a few things that we'd like to share with you visually. My name is Mariana Garo. I'm an epidemiologist here with Thurston County Public Health and Social Services, and I just wanted to share that I have been fortunate enough over the last several months to spend time working with the Thurston County Opioid Response Task Force on the plan that we're looking at today. The Opioid Response Task Force has 2 co-chairs. They are in the room today. Shelley Slaughter from Public Health and Social Services and John Tunheim, Thurston County Prosecuting Attorney, and several members of the task force are here to support the plan that you are looking at today. Thank you all for coming. I'm here today to share with you that proposed plan that we are asking the board to consider adopting. You should have that in your packet, and it looks like this. Last year, the board declared the opioid epidemic a public health crisis in Thurston County, as has been seen across the nation. In Doing that, you did so through a resolution. The plan that you have in front of you has Appendix A, pages 13 through 14, which encompasses the resolution that the Board of Health passed last June. The resolution created the Opioid Response Task Force and provided very clear direction about the plan of action that you wanted provided back to you. So when you look at that plan and what you laid out for the task force's work, you set out 5 goals in that resolution. Those goals included focusing on healthcare-related strategies, goal 2, focusing on treatment and supportive service strategies, focusing through goal 3 on overdose prevention, which was mentioned in the previous presentation, focusing on improving data, and looking at science and innovation and disparities through Goal 5. The task force took your charge very seriously and looked at those 5 areas to propose options for how we could address them locally. But they also, which through permission and how you wrote the resolution, wanted to propose back to you another goal, a goal 6. When they looked at what Thurston County needed to respond to the opioid epidemic here, they thought that what was needed was a goal 6, a goal focused on exposure and access to opioids among infants, children, youth, and families. So in this plan, you will see that additional goal proposed that they would like you to consider having included. In that plan, you will see, starting on page 3 through page 11, 25 separate strategies covering those 6 goals. Those strategies, the task force worked through, worked over, prioritized, considered what would be best for the county by both looking at other plans, the state plan, what would work here, and options available that would make this plan actionable immediately. And several of those strategies are in motion already. These strategies that you see in the plan can be built on as we learn more, as the opioid crisis changes, as we get new science and information, and as more things become available as we move forward. The plan includes also a proposed oversight structure from a recommendation from the Opioid Response Task Force. They are looking at proposing towards you to continue moving forward as a task force to provide robust oversight through a couple of different mechanisms that you can see in that figure that's on this particular slide. One is that each strategy of those 25 strategies has at least one community-based leadership provided at the community level to make sure those strategies have someone to convene them, someone to help move them forward. Folks ponied up to do that, and we're more than willing, and several of those leads are in the room at this moment. They also proposed that through that process of having strategy leads, in addition to the task force, that they also have, and this is what they've requested through the plan, a set of 5 different work groups that in order for them to keep looking at improvements, innovation, and opportunities, that we have work groups that focus on very specific topic areas that have potential to cross over different strategies and goals. You can see those 5 areas on that particular slide. They also thought through the board's need to have understanding of what this is producing. What is the accountability? What are the outcomes? What are the results? And they're proposing that the plan be monitored and oversight accountability be provided by having every strategy have a SMART objective, a specific progress measure that is measurable so that you can see whether or not what the strategy is supposed to achieve is being achieved so that you can monitor that change over time. At the very back of the plan, you also will see that there's a list of multiple individuals, multiple organizations who participated actively in this task force and made this possible. 91 total individuals, 38 total organizations came consistently, participated, provided their input and feedback to you to try to give you their best thinking, knowing that this can be improved and that this is an action plan to move forward. And so with that, I wanted to see, that's a summary of what you're looking at. I wanted to see if you had questions. And then we are hoping that you would consider making a motion to adopt the plan today.
Okay. Where do we begin? Do you have questions?
I don't. I invited myself to the task force in January, and
Okay.
I asked many questions along the way, so.
Yes,
I
absolutely.
appreciate the work.
Go ahead.
Maybe you could comment on the fact that this is going to be, what, a living document or something? We're going to
Yes.
make adjustments
Absolutely.
as need be, so the plan itself is not a finished product, it's a developing and growing product, I guess.
Absolutely. And I would say that when you look at that structure that the task force has proposed to you, that helps to make sure that innovation, that movement forward, as we learn new things, gets incorporated and change occurs to update this plan. Absolutely.
So I guess it'll give us hope, I guess. It'll give us hope for a solution. And
Yes,
I think we're all in agreement we need to do something.
yeah.
Marianne, I have a couple questions.
Okay.
I see goal number 3 and number 5 as closely related. Number 3 is prevent deaths through education and expanding distribution of naloxone. And goal 5, identify and implement strategies that reduce the risk of overdose. So with that in mind, we had a briefing some weeks ago, and we were told about fentanyl strips. So people, they're testing their drug of choice to make sure there's no fentanyl in it, right? To prevent overdose. And I've been told, at least at one of the briefings, that has the use of that saved lives or prevented people from using bad stuff.
I would defer to others in the room, if that was okay, to share a little bit more about that, if that's possible. Is that okay?
Well, is this on?
Yes.
I will make a comment, and then I'm happy to have Maida talk also. So the fentanyl test strips are something that is available, and I'm looking into the advisability. In the past, I have been concerned that they give a false sense of security, like looking for a chocolate chip in a chocolate chip cookie dough. So if you don't get the chocolate chip, you think it's safe to use cocaine, methamphetamine, or heroin. So this is something that actually the health officers around the state are discussing.
Oh, so it's again, like it's a work in progress and
Yeah. a work
ongoing
in
research and
progress.
such.
Yeah.
Okay. And I'm looking at goal number 4. We'll do follow up on that eventually, I would imagine. Yes, County Manager Romero.
Sharon and Mike.
The result of that briefing, we're going to be scheduling maybe an hour for you to hear from the health officer as to the benefits and perhaps the opportunities related to the fentanyl strips. And that was the result of that briefing.
Okay.
And so that is coming up.
Oh, good, thank you. Then I'm looking at goal number 4, which is use existing data and enhance data collection efforts
Yes.
to detect opioid and other illicit drugs to inform the selection of strategies. That sounds noble. But when I look at letter B, and I don't mean that in a facetious way, letter B, the action step is examine data being collected by community-based providers of naloxone. So I would imagine we get data, we the county get data from the coroner, perhaps, of overdose,
Right.
from law enforcement on the use of naloxone. Where else do we get it?
Well, when it comes to that particular topic and area, one of the reasons why it's on this particular list is that there are different providers of naloxone, and we want to make sure that we have a full array of understanding of who is providing that and have this information collected and better available. So there can be a range of law enforcement, other individuals that are providing this, and so this is intent on trying to figure out who all is doing what where, so we have better figures to better understand what is that distribution, where is that occurring, and just better information to make decisions.
Okay, so we get it from the jail, from the sheriff?
There could be a wide range.
medical,
We
okay.
don't have it all organized at this time, and this will help us move forward on that.
However, there's several entities that are collecting that data, but we're not privy to it. We're not
Right,
given
we
that
would
data.
need to form some relationships, which is totally doable, and it's exactly why this is on here as a priority area to work.
Right. And where would those areas be?
In terms of, that's part of what this will look at, is work with in the plan, there's a data work group that's several folks have agreed to participate in, and we're going to take a look at what that would look like for implementing this particular strategy.
Do you have an idea, though, who's collecting data that we don't have access to?
I am not fully informed on all of the details of this particular strategy, but that's where we're going to dive in and get the right people available to better understand that.
Okay. Doctor? Yes, please.
There's a lot of different sources of data. There's 24-hour real-time collection of data from emergency rooms through the Rapid Health Information Network for the state of Washington called RHINO. Then there's information from the Washington State Emergency Management System called WSMIS. There's information that we can also get through use of naloxone by law enforcement officers and filling out of information. We also get some information about that from individuals who use our syringe service programs, and they actually, if they come back asking for a refill of their naloxone, we get some information from them. The coroner also has information, though this is looking into there's so many aspects of how to respond to this opioid crisis that there's a high-intensity drug trafficking information, which is slightly different than the naloxone, but it addresses what substances are being used and how different. There are several different ways of testing for that information.
Okay.
It's-
Well, that's more information than I had earlier, so thank you for that.
Yeah.
Sure.
And if the goal is to save lives and come up with the best strategies,
Yeah.
we need as much good data as we can,
Yeah.
gather.
Absolutely.
So thank you. And go ahead.
And along with that, I guess, I hate to always be the one talking about money, but by golly, all this costs us a lot of money, and we don't have enough resources to really do it right. So I had asked Keely earlier about the 246 cases that we had about overdoses. At some point, each one of these individuals either fully recover or they don't. And at what level, when they don't, do they become a permanent burden on society, thus the taxpayers? And if we look at that for the rest of their life, I mean, if 100 of them never recover, can never become functional assets to community, then it's going to be a cost to community. I would like to be able to pencil that out at some point, and that's why I'm asking that amount of the time period involved before we end up to a situation that they're just not recoverable. And at what point do they become that permanent burden? Or maybe they're just a halfway burden, but maybe they're never going to be able to go to work again. And we need to put a dollar amount to that, because the public oftentimes pays attention to dollar amounts, and I guess that would be an astronomical amount if we figured it just say in the state of Washington, let alone the nation. But in Thurston County, if we had 246, I'd like to know what that boils down to in true cost to society. So at some point, I know this, I don't expect you to have that answer on the tip of your tongue, but
No good
as
grief.
policy setters, I'd sure like to know what that is costing society.
And I would add to that, if it's okay, that concept of return on investment. There's components in this plan that are broader in terms of looking at what is the prevention components of this save us? What are the treatment components of this save us? What do simple things, seriously, this plan has some simple things, but they need more focused attention. Drug take-back efforts that remove unwanted prescription medicine from places where teens could get a hold of it. Prevention components have return on investment aspects to it. So that concept of what this plan could save and some of the costs associated are something we can definitely think through as we move forward. That is your interest area, and it would be other people's interest area. I would just note there's a lot of savings by some of the strategies that are proposed in here that we could also quantify.
You mentioned drug takebacks. Do they have a take-back center in downtown Olympia now?
Not that I'm aware of.
Okay.
we move on? There you go.
So I just wanted to point out on the bottom of page 12, it says that for each strategy in the plan, no less than one SMART objective will be established for the 2019-20 timeframe, and then we'll have progress updates every 6 months. So this was, I hinted during the meetings that maybe we want to make that more specific. It didn't get more specific, but I'm okay because I'm basically looking at that and saying that, you know, when this comes back for a report in 6 months, I'm going to, my expectation
Yes.
is that these objectives will be
Absolutely.
developed, and then, so a lot of hard work's, I hope that
Absolutely.
we move to approve this today, and then the hard work, in my opinion, begins, because we shouldn't pat ourselves in the back. It's going to take a lot of effort by our groups to forge forward, develop the SMART objectives, and then start trying to make inroads.
Absolutely.
So-
And one of the pluses that you have is that you decided that it was necessary and important to hire an opioid coordinator to support this work. And that decision will make a great difference in how far and how fast we move.
So I'm going to turn to the Public Health and Social Services Director, Shelley Slaughter.
Yes, thank you, Commissioner. I want to echo Marianne's comments in response to Commissioner Edwards' questions about the return on investment with prevention. But since we also have my fellow co-chair in the room, Thurston County Prosecutor John Thunheim, I just wanted to draw attention to the fact that the Board of County Commissioners took an action last year as well to join a lawsuit against the manufacturers of the opioid crisis to quantify some of the impacts that this has had on Thurston County citizens who are victims of the opioid crisis. So that's another way in which we can look at what the financial impact is, not on the victims of this crisis, but on those who have perpetuated this crisis to exist in the first place.
A good point. Thank you. Is that it?
Well, other than I just think it is so important to come up with that dollar amount, because it's going to, as this class action suit moves forward, it's going to show a devastating amount of money, maybe more than the United States debt. It's going to be a lot. And I hope we can show that at some point. That's it.
Okay, thank you, sir.
I would make a motion to adopt Thurston County Opioid Response Plan, send it forward to the Thurston County Opioid Response Coordinator and Thurston County Opioid Response Task Force, strategy leads and work groups for implementation.
Second.
So it's been moved and seconded to adopt the Thurston County Opioid Response Plan and send it forward to the Thurston County Opioid Response Coordinator and Thurston County Opioid Response Task Force. Any further discussion?
No, sir.
Nope. All in favor, say aye.
Aye.
Aye. That passes. Thank you, Marianne, very much.
Thank you very much.
Thank you so
We really appreciate it.
And for taking the heat. Agenda item number 6, youth substance use prevention. Chris, there you are, our program manager.
Good afternoon, Commissioners.
Good
Chris
afternoon.
Hawkins, Program Manager in the Community Engagement Evidence and Partnerships section of the Division of Child, Family, and Community Wellness of the Health Department. And I'm here this afternoon to share with you. I'm going to just be very brief in my comments because really the stars of the show are a couple of staff members in my team at the Health Department who are really leading the efforts on youth substance use prevention, which is the subject we wanted to
Name them.
update you about. So we have Kateri Wimsett here and Jennifer Simmons. And of course, we're ably assisted with a lot of excellent data by Marianne O'Garo in our work in this as well. This is an area of significant interest and concern for the community's health because it's connected to not just the present health, but the future health of our community. As the board frequently says in a variety of ways, children are the future of our community. And you've said that not only in these meetings, but in setting a strategic plan that mentions this in an important initiative around improving the health outcomes for all in our community and some specifics about youth in that. So I wanted to just take a moment to talk a little bit about prevention, what that is. Here we're not talking about treatment or helping people recover from a substance use problem. We're trying to prevent them from starting in the first place. So we do that by intervening early, trying to prevent youth from starting to use, because that is shown to have that long-term impact of having fewer people using as they go throughout their lives. We do this by working on multiple levels in the community. As our team's name implies, it means engaging the community. It means working with them on the data, looking at that data, sharing that with community partners, and building those partnerships. We build those partnerships so as to change our community's conditions. We change what services are available. We change the environment around people. And those things are proven to change people's behavior over time and in healthier directions is what we're aiming at. So we try to inform those community partners, support them through some coalition work that you'll hear a little bit more about in a moment. And all that adds up to healthier community conditions and people being healthier in our local county. We really do base our decisions and our program work on the health data that we have available to us. That is built up over time through the Healthy Youth Survey being collected on a regular basis. And the trends that we're seeing in that are some good news and some not so good news. So I wanted to share with you some of that information about youth substance use in our community. Across the whole of Thurston County, we're seeing good news in tobacco use. It's at the lowest levels that it's been for well, probably as long as we've had these surveys going out. Marijuana use is also not increasing in our community among youth. And prescription drugs are, the use of prescription drugs, abuse of prescription drugs is not increasing over time. There's a flip side to that, though. That is still a big area of concern, and so I just wanted to mention quickly that this is an area that connects to the opioid response efforts. Our team works on opioid response by trying to raise awareness of the availability of those prescription drug drop boxes. So we have a pharmacy program where these are available at almost all pharmacies around Thurston County to inform consumers as they are purchasing their medications that there are ways to safely dispose of those drugs when they're no longer needed or wanted. So that's an example of something where we're trying to increase the awareness of proper disposal, and that's going to reduce access to prescription drugs by kids and other family members for whom those medications were not intended. So the longer you keep them stored in your home, the more chance there is that somebody else accesses those medications, and a lot of those are opioids, painkillers, and the like. A couple other bad news areas. Alcohol use is too common. We see an incredible increase in vaping among young people in the community. And then use of substances while driving is still a big problem, and there's obviously too much of that going on. That connects to some other public safety issues of traffic safety and fatality and injury, collisions, crashes in our community. So with that, I kind of want to turn things over now to a couple of our staff people who lead efforts with youth coalitions, coalitions focused on youth substance use in our community, as well as some specific substances that they work on. I'm going to start with Kateri Wimsett, who will talk with you about tobacco and vaping a little bit.
Thank you, Terry.
Good afternoon, Commissioners. I'm Kateri Wimsett from Public Health and Social Services, and today I'm going to talk to you about a couple different parts of the work that I do with the community. First of all, the Tobacco and Vapor Product Prevention Program is funded by the Washington State Department of Health, and tobacco use remains the #1 cause of preventable death both in Washington and in the United States. It kills more than 480,000 people every year in the United States. Tobacco use prevention is very important because we know that 99% of adults who smoke or use tobacco started before age 25, and 93% start before age 18. So when we look at the connections of brain science and addiction and these kind of prevention programs, this is really vital. Nicotine is the drug that makes cigarettes, vapes, and other tobacco products addictive. And so when an addictive substance like nicotine is introduced to the brain while that brain is still forming and growing, it primes the brain for use and addiction. Now, conventional tobacco use for youth is low, but vaping is growing and is a significant problem both here in Thurston County and across the nation. 2 years ago, our surveys said that 23% of Thurston County 12th graders vaped. Now we're at 32% of 12th graders using vapes. We know that kids who use vapes are much more likely to try cigarettes and other substances. So the slide in front of you here is part of a local campaign that we have run both on social media and on transit as part of our work. Additionally, we're currently working to strengthen healthy behaviors and norms in our community by working on an ordinance for your consideration regarding vaping in public places. We know that these kinds of protections set healthy behavior in public as the norm, and they also protect clean air as a standard in public places. Another project that I'm fortunate to work with is the Community Prevention and Wellness Initiative that funds the Bucota Tenino Healthy Action Team, or BDAT. BDAT is a community coalition that is made up of local organizations and volunteers from the communities of Bucota and Tenino. And this is an amazing group that works together to prevent and reduce underage alcohol and drug use through education, building relationships, and promoting positive, healthy lifestyles. This group is supported by an amazing amount of partner organizations, including the town of Bucota, the city of Tenino, Tenino School District, the Educational Service District, the Tenino Police Department, Thurston County Sheriff's Department, and many, many others. This picture here on the slide is, on the right-hand side is a part of our group that worked together. And then on the left-hand side is a picture from our most recent prescription drug take-back event, which happened this past April. At our events this year, we collected over 275 pounds of drugs from 49 people. And this is just one of the many activities that this local coalition works together to support, including things like parent education and teen events. Now, I'm going to go ahead and pass this on to Jennifer Simmons to talk to you about the Youth Marijuana Prevention and Education Program.
Yeah. Thank you, Kateri. Thank you. I was commenting on your picture.
Thank you very much for having me. I'm Jennifer Simmons, Public Health, and I'm here to talk to you. Let's change the slide. Well, let's see. Let's change the slide. No. Let's change the slide. There we go. There we go. Thank you. I'm a little technologically challenged. So I'm here to talk to you about youth marijuana prevention activities that we've been doing through public health, and also later I'll tell you a little bit about the Tumwater Hopes Coalition, which is a brand new community coalition here in town. So I wanted to tell you first off about marijuana. We know that adolescent marijuana use has been shown to impact cognitive functioning and negatively impact depression and anxiety. And most teens that are entering drug treatment in Washington State report marijuana as the main drug they use. So while there was good news on that slide saying that kids are not reporting higher rates of use, what we do know is that perception of harm rates are continuing to drop. So kids are perceiving marijuana as less harmful. And we also know that the potency of marijuana is very high, so there's a lot of information that we don't have in terms of the health effects of using marijuana, particularly today. So, Thurston County Public Health is part of a regional effort to combat youth marijuana use. We are members of the Youth Marijuana Education and Prevention Program, YEMPEP, and this is a regional group that endeavors to increase the protective factors and support families to decrease youth marijuana use. So it's a 5-year plan, and one of the activities that we did is we promoted a drugged driving, don't drive drugged driving campaign. Marijuana, people, the perception of harm and the perception of risk of driving while under the influence of marijuana is very low with the adults and youth, and so that's something that we've been working on at the Public Health Department. We also delivered school signage, which these signs have been in schools, but we're also expanding their reach. So to promote awareness in schools, the message around vaping particularly, but also to encourage parents that are picking their kids up in the parking lot, that sort of thing, that it's no vaping on the entire campus, not just at the doorway of the school. So schools are tobacco, drug, vaping, weapon, cigarette, all of it free. And that has to do, of course, with role modeling, community norming, and, of course, smoke exposure. So we also are working with our school partners. The Office of Public Instruction recently put out a change in policy away from the automatic suspension for kids who are caught with drugs or alcohol on school. It used to be an automatic suspension sort of standard policy. They've evaluated that, and they've now put forth a recommendation that youth are treated differently and that substance use is seen more as a behavioral health issue rather than a disciplinary issue. Not saying not to give the kids consequences for being caught with drugs and alcohol, but also to really respond in a way that better addresses what's going on. So that is what YEMPEP has been up to, and we'll be expanding those efforts next year. So what I'm really excited to tell you about, too, is the new coalition that has just been created called Tumwater Hopes, which is healthy opportunities for prevention, empowerment, and success. So this is much like Be That, which has been around for a number of years. Tumwater is brand new. We've been, new slide. Tumwater Hopes. So this is the logo that was created by one of the members. We've been meeting every month, and we have a leadership group that's actually been meeting once a week since January, which is spectacular. Actually, the number of volunteer hours that the Tumwater community has put forth has been amazing. We've also had incredible support from the City Council, the Police Department, the school district, and nonprofit partners in the faith community as well. So what we've done in the last 6 months, and this is the mission, let me first tell you, the mission of Tumwater Hopes is to collaboratively prevent youth substance use in Tumwater as an inclusive, engaged community where everyone belongs. In addition to youth substance use, we're also concerned about depression, anxiety, and suicidal ideation. And the coalition really sees community connectedness and bonding, whether it's family bonding or bonding with another healthy adult, as a major thing that the Tumwater wants to do to influence youth substance use. So we are designing and managing a website that will serve as a resource for the Tumwater community. We've just recently, as of Saturday, trained 20 teachers in the elementary school system in Tumwater in a best practice behavior modification program called Good Behavior Games. So this program is shown to have significant impact on long-term outcomes for youth, mental health, and also substance use. We are providing parenting classes to middle school parents. We are collaborating with the Tumwater Police Department on National Take Back Day, which you declared the proclamation for. That was Tumwater Hope's big first step. Thank you very much for that. We recently selected to provide funding to Big Brothers Big Sisters, which is going to expand a mentoring program with high school students, mentoring elementary school students in the Tumwater School District, and using the Boys and Girls Club as a third partner to work as a space where the kids can meet up. The high school students can meet up with the elementary students. So it's called a Bigs and Littles program. So we're going to be doing that. And then also we are going to be, through our website and also through community outreach events, do public awareness campaigns, similar to the drug driving campaign that YEMPET did. And that is Tumwater Hopes and Youth Marijuana Prevention. And that is all we have. Thank you.
Questions or comments?
Good job.
Very good job. Very good job.
Thank you very much.
And we'll
We
be
look
hitting
forward
those-
to working with you further on that important policy dimension, which reinforces the community norms about use less of these substances, the vaping in public
Right.
places policy.
And now that the school's ending now this month, we'll ratchet it up again August, September?
That's right. We'll be restarting in the
Good.
fall with, and actually these coalitions carry on through the summer month because they're community coalitions that
Perfect, thank
keep
you.
going even though the school year is out.
Terry, Jennifer, Chris, thank you.
Thank you very
Chris,
very
real
much.
quick, what were smoking rates pre-vaping? I mean, 32%, is shockingly high to me. And that seems to me higher than, like, before there was vaping, wasn't it like a quarter of people
Thinking back 10
smoked?
years ago, the rates of, yeah, 15, 16%.
So double the amount, more than double, because of whatever advantages people see from vaping. I mean, perceived.
It's also, which Jennifer could point out, I was fortunate enough to go to a retreat that she held with her Tumwater Coalition this weekend, and to listen to parents talk about what they're seeing in middle schools. And one of the things they talked about, particularly with vaping, is you can bling it. It has a lot of attractive elements to it. It has different flavors. It's a whole different kind of creature in terms of substance use concerns, not just what's in it, nicotine, marijuana, or toxic chemicals, but the attractiveness to teens and tweens is something that the parents were recognizing as contributing to the interest in youth as well. So.
Go ahead.
Does all vaping have to do with tobacco usage? I mean, do you vape, I don't know, mint or something like that? I mean, do they try to get you into it by doing something besides tobacco or marijuana?
So you can vape many substances. You can vape what's considered e-juice, which could be a flavor and a mix of other chemicals that meld together when they're heated. Most kids do report, at least in Thurston County, that they are vaping nicotine, but you also can vape marijuana and other substances.
Back in the 60s, they were smoking banana peel. Is this a product, the e-cigarettes and the e-whatever vaping, is that banned even at the high school level by the school district?
Actually, by the state, all those products
state,
are
all
illegal
schools are
on school
drug-free.
property as
Oh,
part of
okay.
RCW.
Perfect, okay, thank you.
I wanted to quickly mention that at Tenino's site, we also have NFP as one of the projects that the coalition is supporting, and so we're funding Nurse Family Partnership Services in that community as part of this drug prevention, youth substance use prevention
I
effort.
tell you,
So
Tenino's
starting
on it.
early.
Tenino's on it, 'cause I see they have a prescription drop-off box still at the police department,
Yes, they do.
as some of the cities don't. All right, thank you very kindly. Agenda item number 7 is summer safety bots and brats, or is it bats and brats? I know what it is. Sammy, come on up. Senior Environmental Health Specialist, Sammy Bird.
And apologies to the Brats and Bands Festival that goes on later. It's just too good of an alliteration to pass up.
Yeah.
My name is Sammy Berg. I am the supervisor for the Food and Environmental Services section in Environmental Health for the Health Department. And I'm here to talk about two primary topics around that become more prevalent in the summer months. One is bats and our attempts to prevent people's exposures to rabies, and the other is foodborne illness and trying to improve folks at home food safety practices. And so bats are great. They do a lot of beneficial things for us, including eating up quite a few insects. Our main challenge is when they actually end up in people's homes. And they are fortunately one of they're the only carrier of rabies in Washington State in the natural population, as opposed to other parts of the country or the world where they have dogs, raccoons, skunk, fox, coyotes, whatnot, other mammals carry it. We get lucky, and for a variety of reasons, Washington is just in the bat rabies business. And so it makes my job a lot easier when we talk about people who get bit by a variety of animals. Generally, we have very few levels of concern except for bat exposure. Basically, we get about one positive bat for rabies in Thurston County a year. Last year we had
What was that number?
One.
Oh,
So, for instance, 2018 was a pretty average year. We sent off about 20 some odd bats to be tested because there was some sort of human exposure, and the state ran the test, and one of those 20 came back positive for rabies. Unfortunately, in that case, it was a bat that was found in a daycare setting, and so we had a number of young children that were potentially exposed. And so it was kind of the worst scenario, or one of them certainly that we can imagine, where we have a lot of people exposed to a bat that then tests positive. So part of the message basically is no touchy. Don't play with bats, either as children, or certainly we can, work with as adults, try to educate the children and grandchildren that we have interactions with to not touch wild animals, in particular bats. We also, across the state, about 6% of the bats that they test are positive, and that's been a very stable number since the 1980s, where we have good information about that. So the good news is that the rabies population, or the amount of rabies in the bat population, is pretty stable. And just because we have one positive bat in Thurston County doesn't mean all the bats are a concern. It is a disease that kind of spreads slowly through the bat population, and so, and like, for instance, we had a bat positive a couple weeks ago. Fortunately, no one was exposed to it. The man chose to test it because it was a bat that he found right in front of his front door, and he knows that there's a number of bats that roost right in front of his door. So he's concerned, which makes sense. And that one bat tested positive doesn't necessarily mean all the rest of the bats in that grouping are a problem, nor does it mean if it came back negative that that's still not something to be concerned about. And so it's always something we have to evaluate kind of on an individual basis. Our main messages around that, though, is if we find a bat in your house, to contact public health so we can talk about hazard and the potential for human exposure before the bat's released. Because we definitely want to make sure that if we do decide we need to test it, that it's still available. We hate to hear someone say, yeah, we found a bat in our house, and then we let it out, and then we called you, and then we're like, well, we really would have rather been able to test the bat and prove that there was no concern. Because we want to be very conservative, rabies is inevitably fatal. There's no good treatment, although we can prevent it through vaccination. But it's much easier to test a bat and show that there's no concern because the bat's negative. One of the things that we're also trying to help people understand is that after hours or on the weekends, public health is available through 911 dispatch. So if you do have a bat in their house, again, try to contain it, keep it in a room, do what you can to separate people and the bats, and then give us a call so that we can then try to help figure out what needs to happen next.
That's good to know, 24 hours a day, 7 days a week, that's good.
Yeah. And I've taken many calls after hours and on weekends, and have been able to help people understand what happens next and get them through that kind of unfortunate kind of circumstance. We also get really good support for rabies and bites and whatnot through Joint Animal Services in Thurston County. They're very helpful, especially with dealing with the various cats and dog things that go on around bites. And again, for those, since we don't have as much concern about those kind of bites with rabies, we're able to deal with that in a much lower level of concern. But working with Animal Services makes that a much easier job. We get about 100+ calls a year about a variety of bats or bites kind of situations, and spend a fair amount of time helping people understand that. One of the things that people can do to help kind of create a buffer between the outside and their family basically is keeping their pets vaccinated, especially cats, because cats are very good at catching bats. And then bring them home, look, I've got a little present for you. And we want to make sure that having them vaccinated provides that buffer between them and our families.
So at the risk of sounding like Dr. Seuss, if a bat bites a cat and it's got rabies, the bat, it passes to the cat, and then the cat can pass it to the family?
Yes, so rabies is spread through bites, scratches, saliva contact generally. And so, yeah, usually it's a bite action that then spreads the disease. And that's one of the reasons to make sure that the pets are vaccinated, because that's the best protection we can. And in reality, if, say, a cat goes after a bat, usually they're very successful at that, and the bat has no, they're just killed, and there's no bite going on. But if there's that kind of interaction, we have no way of knowing. And then if the cat is unvaccinated, then we're trying to figure out, is this cat now a potential risk to the family? And that puts us all in a place we don't want to be, is trying to evaluate an unknown around a loved pet, as opposed to one that's vaccinated, we have far less concerns about.
Right, and I trust most people get their dogs vaccinated, but cats, I'm dodgy about that.
Right, and even for cats that are indoor only, because we have a number of people that call and say, hey, I have a bat in my house, my cat caught it in the house, what do we do next? And so just because it's an indoor-only cat does not mean it's safe from exposure. So definitely, and it is state law, all dogs and cats need to be vaccinated routinely for rabies to avoid that kind of situation.
One other thing I would just like to throw in is that sleeping with screens on your windows is a nice idea, and with the door to your bedroom closed, because so often we will get calls of, oh, there's a bat in the house, and if the door to the bedroom is closed, you're more likely to say, well, you weren't exposed to the bat. But if you sleep with your window open, no screen, bats can fly in.
Yes, and so vaccinating your pets, keeping your screens in place and repaired, and then also we have had a number of bats come down chimneys, and so making sure that the flues are closed or that you have the chimney caps on in place. These are all things to help keep them out where they belong, out in the outdoors doing their thing and out of from our homes. We see more of these type of interactions in the summertime because people are hot, they're trying to cool their homes off, the doors are open, the windows are open, the garages are open. And so not that the bat's behavior is changing that much, it's just we're having more potential for interactions with them. There is a website, there's a bat conservation group that's international, and they have good information on if you find a bat in your home, how to catch it. And so batcon.org is a great place to go to get that information about how to contain it. And then again, give us a call and we'll try to figure out what to do with it. So moving on from bats to food. Another good food safety website, or another good website to take advantage of, is foodsafety.gov. It's put together jointly by the Centers for Disease Control and the Food and Drug Administration. Primarily, they talk about a variety of basic food safety guidelines. One of the main things that we're always trying to reinforce is wash your hands, wash your hands, wash your hands. That is one of the most basic things that is also the most effective ways to prevent foodborne illness with you and your family. We care a lot about foodborne illness because on average, from national estimates, 1 in 6 people will have some sort of foodborne illness each year. And I know that I've been certainly gone through the uncomfortable process of being foodborne ill, and I know that most people have, and certainly want to avoid that in the future. And there's also, as best estimate, about 128,000 hospitalizations due to foodborne illness each year. So again, a pretty high burden on the society due to these things which we can do a better job of preventing by trying to just keep our hands clean and keep our dirty hands out of our food and other people's foods. But while we're doing the summer thing, there's a couple things that we can keep in mind. One would be the four kind of basics that the FDA put together: clean, separate, cook, and chill. The clean part's easy. Keep your hands clean, clean your cutting boards, clean your utensils. The separate is trying to separate potential source of germs, and for home cooking generally it's raw meats, from other produce, fruits, or cooked items. So the classic of, I'm going to take my plate of raw burgers out to the grill, I'm going to cook my burgers, and then I'm going to put those cooked burgers back on that plate and take it back in. Well, that has germs on it, so bring 2 plates, Right, yeah. That's not a smart move. And it's pretty simple practices to just think about to change and greatly reduce your risk. Cooking is pretty straightforward. We certainly recommend trying to use a digital thermometer to measure things, in particular things like chicken and hamburger, color, texture, the visual look of it, is it still pink juice oozing out of it? All those are not the most accurate way to figure out, have you cooked the thing to the proper temperature? And we're not trying to rule the world with overcooked burgers, but we are trying to prevent E. coli and salmonella. And having a burger that is fully cooked certainly beats spending 3 days on the toilet. And so cooking those things to the appropriate temperatures. Ground beef is, for example, 160 degrees. Poultry items are 165. But using a thermometer to try to figure out whether that's done is one of the best ways to make that work.
And chicken tartare is not advisable.
Chicken tartare, no, it's right up there with like gas station sushi. Yeah, just not advised.
Wow, you beat that good.
One last step also is chill, and it's kind of the idea that bacteria grows best in kind of these kind of temperatures, where we're talking about something between 70 and 135. Bacteria just love it, and so if you have something that's potentially contaminated and you let it sit out in that time period and that temperature, then it has the ability to grow and become much more of a problem. So putting foods away into the refrigerator, or like if you're having a large party and people bring a variety of potluck foods or whatnot, trying to not put all of it out at once, keeping some of it in the house, in your refrigerator, or in the oven, or whatever, and resupplying as needed. The classic thing of everyone comes, they lay down the table out in the sun, and it sits for hours. That potato salad that's just kind of fuming and growing things is a classic example. And really what we want to do is try to just understand that, help people change a little bit of practice, put out half that amount, keep the rest in the fridge, and just think about how long has that stuff been out. Does a potato salad need to sit out for the full 4 hours of your picnic? No, have it out. If people, then put it away, and if people want more, it's in the fridge, kind of thing. There's also, what do you do with all the food that's left over? Well, if it's been out for more than 2 hours, the best bet is to throw it away. If it's stuff that should have been refrigerated or kept hot, if it's been out for more than 2 hours, there's been enough time for bacteria to start growing on it, and you can't safely recover it. So if you do want leftovers, then put less out so the rest of it stays at the temperatures it needs to, and you can do that. Or be quicker about getting that and putting it back into the refrigerator so that it cools down and it's safe to reuse. One more thing, in the summertime are going out to picnics, bringing your cooler full of stuff. And this is another place where we can have serious problems. One would be, I have my cooler full of my stuff I'm going to grill, and it's got my raw hamburger patties and my cheese and my lettuce and my tomatoes and my drinks, and it's all in one warm, melty water soup, which would be not a good way to think about it. But that's what happens, is that if you got, especially a lot of melted ice and all these things in there, there's a potential for that cross-contamination. And so definitely if you're carrying raw meats around in a cooler, have it be in a dedicated cooler. When's the last time you've washed and sanitized your cooler? You know, not often. And we don't expect people to be perfect about that, but one of the easiest things to do would be to have a small cooler that's a different color, and that's, you know, your raw meat cooler. And then everything else goes in the cleaner cooler, and there's just less concern. The other side of it would be the idea of, I'm going to have this big cooler full of melted ice water and a bunch of cans of pop. And all day long, people are going to reach their dirty hands in there and grab that can of pop. You know, like the kids at the baseball game or the soccer, like they're not washing their hands, and they're not washing their hands before they reach into that thing. And so again, you have kind of this warm, dirty hand soup thing that's all over the tops of the lids of these things. Things to think about, and you know, I'm paid to think about these things, and so, but I'm just trying to, you know, put a little bit of a bug in your brain to think about them a little bit more, so that we can hopefully avoid less bathroom time and enjoy more outdoor time and family time. And
You're fun at a picnic, aren't you?
there is a certain part of you where you kind of have to turn off some of that professional side and enjoy the outdoors and the cooking. But yeah, I mean, it doesn't take a whole lot to have just think about things a little differently and protect you and your family and from some foodborne illness, and that's what we're here to do. Again, that's summer safety around bats and food, and again, trying to prevent exposure and reduce disease burden, and that's what public health is here to do. Any questions?
Any questions?
No, sir, thank you very much.
Okay.
I can't top your gas station sushi. That's it. Sammy, thank you very kindly, sir. Thank you.
You're welcome. Thanks for your time.
Agenda item number 8, Wildfire Health and Safety Art Starry, Environmental Health Division Director.
My slide. So I'm Art Starry. I'm the Environmental Health Division Director, and I'm going to turn things over to Vivian Eason, who's with our Emergency Management Department. She's going to quickly talk about things that you can do to help protect your property about wildfire. And people don't think necessarily we're in a wildfire area, but if you look at that picture, that's the one from the Scatter Creek fire 2 years ago. So that was right here in little old Thurston County. So I'll turn things over to Vivian, and then I'll talk a bit about smoke and health issues like that.
Good afternoon, or is it close to evening?
It's afternoon still.
I'll be really quick. So, yes, the 2017 Scatter Creek fire did kind of bring home that we are at risk for wildland fire in Thurston County. We call it the Wildland Urban Interface Area. That's where we have homes that have moved into the area that there's more wildfire capability. And as you know, I live in Rochester, so it's an area that we see a lot of fires throughout the summer. But the 2017 catastrophic fire really brought to light that we needed to do more education on wildland fire. So we received a FireWise grant this year. It was a mitigation grant, and that was afforded us to bring in 2 professional trainings, and we had the first one in April, so we attended that and got really smart. It was a very intensive 2-day class. We have a second one in October. We opened that up to some of the CPED folks, county staff, emergency management, neighborhoods, and first responders. And so we'll have that second class coming up. So what we've done is I've did a lot of research, and I picked out some public education items, and you have a packet there of some of the items that I ordered through the National Fire Protection Agency, and then I selected ones that we could download and copy and hand out at neighborhood associations. So I've been invited out specifically for fire education to Griffin Fire, the Griffin Neighborhood Association out at Steamboat Island, because that is a very woodsy wildland fire opportunity area. And then also Foxhall out in the South Bay Fire area. So they'll talk to their fire chiefs, and so we're just spreading the word on how you can better make your home more defensible when firefighters come in to protect your home. So there's a lot of things you can do in advance, and one of the handouts that I really like is this one. I gave you a copy of it. It's really quick, and it gives you a little checklist. And then the second one is where you actually can make your personal wildland fire plan. So one of the landscaping is important. Less beauty bark, more rock. Not a lot of debris, vegetation up close to your home. We were able, as part of the training, we went out and gathered around a home, and we went and looked at areas we thought they could better prepare their home to make it more defensible for wildland fire. What you're looking at is a wildland fire brings in a lot of embers blowing through the air. So what's going to catch on fire if those embers land on it? So I have a lot of fir trees around my house, so my gutters were full of pine needles. So ensuring that your gutters get cleaned out, making sure that you have screens over your, they call it 1/8 mesh wire over your soffit vents and your attic, so that the fire can't make a way into your home.
Or a bat.
Or a bat, yes. Bats are cute. But making your home a more defensible space so that when firefighters come in, they actually have a home to save. And the statistics I was looking up on the National Fire Protection Agency website was 80% of homes lost could have been saved if there was a fire-safe practices with that home. So looking at what kind of roofing material using, and my understanding is eventually Washington State may change some of their codes in building new homes, making them more protective for fires, like what kind of roofing systems, landscaping, making vegetation not right up against the home. One of the things I did recently is I just ripped out all this brush along my one side of my house and just put in some planters with dirt, so I had less weeds to do. I like it simple. Keeping mowed. We have 4th of July coming up. It's really dry. I was out in the forest this last weekend, and the water level in the creek that we go to is probably down to where it usually is the end of summer, and so it was pretty low. My dog couldn't find hardly any swimming holes, which was very sad. But so living out in that area, you know, I'm looking at it myself, and so I'm trying to spread the word with all the public education outreach we can. Thurston County website, emergency management website, our social media, community meetings. We have volunteers that go out to safety fairs for us, so we're taking all this out. And so if you have an opportunity to share, we have set up a website in our emergency management. We have a web page for Firewise, so they can go there and get more information. So I just want you to be aware of what it is, and then Art's going to talk to you about, because where there's fire, there's smoke, or is it just the opposite? Where there's smoke, there's fire?
Yeah, I think it's that way, either way.
Either way, so it's your, thank you.
Thank you, Vivian.
So, I'll try to be brief on things. I know things are running a little bit late, but so Vivian talked a bit about what folks can do to protect their homes, and you know, the question is, I think that everybody asks is like, well, what really is the risk? Do we have any concerns here in Thurston County? And obviously we did in the past. And if you look at the most recent maps that are being produced there's a consortium of folks who deal with fire safety and fire risk. The map that's up on the screen there shows if their projections for July, and you see the red zone, that's the universal color for bad, is that the west side of Western Washington is rated as a high risk for fire. And we don't have a lot of time, but if you were to click on that website, you'd find out that the map for next month, for August, is worse. It starts to get bigger. And people tend to think that Eastern Washington's the biggest risk for fire, but if you look again at that map, you can see that a lot of Eastern Washington's in better shape than Western Washington. So things, I think our reality is that fire and smoke are going to be something that we have to be concerned about in Thurston County for a long time. And so just sort of be aware of that. So don't think that's just something that happens in Butte County, California, or in Eastern Washington. It's a Thurston County thing. As far as what people can do when there's smoke, there are a variety of folks who have, well, smoke can be a public health concern. It can be an individual concern as far as where it affects you individually. When we do have smoke, the symptoms that you're going to start to see, and I'll click ahead here. It can be everything from watery eyes to having difficulty breathing, coughing, sneezing, stuff in your throat. And so that's your warning that things should be of concern to you. And when that happens, there are measures that you should be taking or considering, particularly if you're a high-risk person or someone who has, a cardiovascular disease, you have problems breathing, folks who are, small children, the elderly. Those are folks who are going to be most affected by smoke. And when that happens, there's some basic things you should be doing. Okay, reduce your exercise. Don't be, if you're an avid jogger, maybe it's not the best time to jog quite so much. To reduce your exercise activities. Try to find a place where the smoke can be managed more appropriately. So if you're fortunate enough to have a well-sealed home that's got a good ventilation system in it, maybe you want to stay inside. If you have the opportunity to get away, maybe that's a Western Washington thing and the forecast is it's going to be smoky for a few days and you have a chance to go visit a relative somewhere that's outside of the smoke zone, maybe that's a good time to go visit them. Again, look for a kind of a safe haven in your community. Again, people might choose that this is a good, maybe I'm not a mall rat, but this is a good time to go there because they've got better air handling equipment. So try to give yourself a respite for things. And again, if you're really, really of concern and you're starting to see the symptoms, again, it might be a good time to go visit your doctor and see if there's something that they can do to provide care. It's kind of straightforward. The good thing is that for most of us, when the smoke goes away, the health symptoms go away, but if we have a really bad situation, it is something to be concerned about, and it's something where you should be trying to take precautions. Folks sometimes ask, is it okay? Should I put a cloth over my mouth? Should I put a dust mask on? If you have a properly fitted N95 dust mask, it can provide some help, but it's still not a good idea. And the fact of the matter is that most people, when you go to the hardware store and you buy that N95 mask, it's hard to get it to fit right. A lot of those paper, kind of the ones that are kind of the paper ones, and if you have a mustache or a beard, then like Commissioner Hutchings, then you're in trouble. You need to get a different type of mask. So not probably your first choice. There are some resources that you can use to try to find out, well, what's it like either in my community or where I'm going to go to visit. There's something, Department of Ecology, and there's actually that, let me go back here page. I killed it. WACA, so if you go to Department of Ecology's website and you type in this WAQA thing, it will eventually allow you to get to a couple of links where you can see a map that looks something like that one. And those are the air monitoring sites across the state of Washington. And so there's a color key over to the far left-hand side of the map. And it's, again, it kind of uses the universal color code that when you start to get more orange and red, that means that it's getting worse. And so when you see those conditions in the area where you're going, then that may mean that, I need to take some precautions. Maybe I should avoid the trip, or I should at least try to get a better idea as far as the forecast is concerned. And when this map was produced, you would see that there was not much going on. I don't know if Lydia can click on the link or not. We're trying to use technology here. This is scary. We'll try to go live to their website. And you can click on the map again, I think. And in just a few seconds, we'll find out if there's a lot of smoke over in Grant County. And actually, things are in pretty good shape right now, so that's good news. So, but it's pretty simple to use. Even people like me can use it while we're in a meeting, with Lydia's help anyways. And so it allows you to go and see what's going on. I guess for those who are really into air monitoring geekdom, you'll find out that there's the state of Washington system, which is slightly different than the EPA system. But I think for someone like you or I who's trying to figure out, should I be going to that place or should I be concerned about it? Again, use that universal color code. When you start seeing orange and red, that's of concern to you. And you can use the key over to the side to tell you what's going on. If you have a phone and you click on the weather, so-and-so's weather service, you might find out that they're using the EPA system rather than the Washington State system. I don't know that most people need to worry about that. That's something for Dr. Wood and you as the Board of Health to worry about when we're talking about standards for making recommendations to folks, but that we won't get there. So if you can close that, Lydia. We'll now go back to our, oh no. And try that again, oh no. Hey, it went back. This is the first time I've tried this, so I'm pretty excited. So there's the map that you can see. So the other thing that you, as far as that, that's really about all I have to say at this point. There's a lot of information that's available, and when there is fire danger, when there is smoke, there's a whole bunch of community partners who work together to provide that information. There's the emergency management, there's the health department, so we'll use social media, the State Department of Health, the Department of Ecology, and of course the news media. It seems like when there are fires and there's smoke danger, there's plenty of information to go to. So I won't tell you which site to go to. I think it would be pretty easy for folks to find. But again, when you get the maps, look at the key, look at your individual risks and how sensitive you are, and that can help guide your decisions on what you ought to be doing. So any questions about that? I know I'm going fast, but, okay.
Aren't you going to hit this one?
What? Oh, I'm getting there.
Okay.
Okay, we've got, that's when I'm so pleased with that slide too. So you asked a little bit about drought. And not surprising with the weather being warm and with us worried about wildfires and things, the state of Washington is also in a drought zone, or at least the governor declared drought for much of Washington, including about 3/4 of Thurston County, everything but the Nisqually watershed, if you follow that. And so is there anything that you or I are going to do about causing the drought to change? Well, no. But the things that you can do are basic water conservation measures, the sorts of stuff that you might, I guess what you'd imagine is there a way to avoid using if you reduce the amount of water that you're using. In Thurston County, almost all of us are on wells. If you reduce the amount of withdrawal from the groundwater, that's more likely to keep the well operating throughout the summer. And while most of our big utilities and things are in good shape, if you have a single family well or you're part of a small water system, they're more vulnerable in some parts of the county. So again, using less water helps conserve the resource, which is always a good idea. But also for the more vulnerable water supplies, it just helps reduce the chance that you're going to turn on the tap and hear that kind of sucking sound, which would be really bad. Yeah. So if you have concerns about your water supply or your individual well, you could contact us at the health department. We have quite a bit of information about wells. You could contact your utility operator. They could tell you about things. But as far as what you can do to help minimize your risk or the chance of things, again, it's basic water conservation measures. If you don't need to water your landscape, if you don't mind a brown lawn, that's a good idea. I know Vivian says that we need to keep our plants near our homes nice and green because we don't want our house to catch on fire. But as far as having a well-mowed lawn that's brown, that's not a problem. Trying to, maybe you don't need to wash your car. Try to make sure you're conserving water within your home. It's pretty basic stuff, and I won't go into any more details. I do want to let you know that something that Dr. Wood and I will be coming to you with, along with Shelley, in the future is that the state, the health officers across the state, along with the environmental health directors and the Department of Health, are trying to come up with some guidance for health officers and boards of health to use when determining whether to make warnings or to consider closing events and things in the event of wildfire smoke. The folks in Eastern Washington have gotten some practice at this, but there's not a lot of consistency across the state, and so we're trying to come up with some guidelines or measures that can be used so that we're making good health-based decisions, and so that if someone say there's a fire in or there's a lot of smoke in Thurston County, there's a lot of smoke in Mason County, we don't have two health officers making totally different decisions. We want to be able to try to provide some consistency because when we're not, the public kind of wonders what we're up to. So we want to try to manage that. So that's coming soon. And last but not least, just a reminder that as far as wildfires and stuff, Smokey he's now 75 years old this year. And so there's a lot of things that you can do to try to prevent fires. If you go back and look at different things, most of the wildfires that we have are a result of human activity. Every once in a while, Mother Nature plays a trick on us by having a lightning strike or something do it. But a lot of the times it's because of us. So just be cautious and do what you can to prevent fires. So I found that old poster and found out, was reminded that Smokey's 75 years old. So happy birthday, Smokey.
We need to get him to one of our briefings or something.
We could try.
Yeah.
And that's it. So I want to thank Vivian for coming and talking. And then there's my contact information if people have any questions for me. And if you have any questions, I'd be happy to try to answer them.
Questions?
Thank you, Art.
Questions? No. Thank you very much, Art. And thank you, Vivian, as well. Do you have more of these one-pagers with you or not?
I brought them with me.
Okay. Can you leave about 10 or so, 15?
Yeah.
If you have them. If not, I'll make copies.
No, I can.
All right, thank you. That takes us to the health equity portion, number 9. Marianne is back. Welcome back.
Thank you. I will try to make this incredibly brief. But I wanted to take a few minutes to share with you today some work that we're doing around health equity and a pretty exciting opportunity that's on the horizon, just so you're aware that that's coming. To start with, earlier this year, you heard the good news that Thurston County is ranked 5th healthiest in Washington State. Wonderful news. We're so happy to have that distinguished honor of that ranking. But one of the things that we know that is possible is that we can improve that. And one of the ways that you can improve our overall rankings is to address health equity. And the concept of health equity is that though 5 is good news for us, if we want to keep improving community health, we need to address disparities, differences in groups that are avoidable, and truly work to gradually and continually eliminate those disparities which produce different health outcomes for different populations and different groups in Thurston County. So the department has been working on health equity for some time. It's an important component of the county strategic plan. We do partnership work around this topic. One you've heard of before, the Local Impact Network, which addresses oral dental health issues. And for example, that's a health disparity-focused health equity project because they're focusing on differences in dental health by age. There are significant differences in Thurston County depending on whether you're very young or you're an older adult, because of access to insurance issues and other issues. We're doing a partnership project with Thurston Thrives that I'm going to come back to in a minute because that's one of the opportunities that I wanted to share with you that's happening. The department is doing work, for example, around language access, and that means addressing and improving our ability to interpret and translate, provide information in other languages, which, for example, when you think of Sammy's presentation and other things we do, it's very important that we be able to communicate our messages during outbreaks and other events. So we've been working on strengthening that within our department. And we also have recently, the leadership team of our department adopted an organizational action plan that looks at workforce development around health equity. The really exciting opportunity I want to make sure you were aware of before it launches is that we have the opportunity to partner with Thurston Thrives to conduct a health equity community health assessment. And in looking at what that process will look like in 2019, I wanted to make sure that you were aware of a few things that we will be doing so that when you hear of them, you know a little bit more about that. One is a community health assessment is a process that is data-driven and community-informed, and it's designed to identify where improvements are needed locally. Health departments and districts across the state do this about every 5 years. This particular time, with the partnership with Thurston Thrives, we're going to do it as a health equity assessment where we look at disparities. And so on this slide, for example, we want to take a really good look at what data is available to describe the health of different populations, whether that be veterans, whether that be rural Thurston County or urban Thurston County. And so this month we will be kicking off that effort at the Thurston Thrives Coordinating Council. And the Coordinating Council has invited in members of our community to start talking about what is standing in the way of achieving health for all in Thurston County and how we can do this community health assessment process in a way that makes data available for people to make decisions and better understand what the disparities are locally. So we wanted you to know that was happening, and if you hear anything, it's a wonderful opportunity, and that will result in a report that'll be available with local data, rich local data, around all kinds of important health issues in Thurston County. So that's what I have for you. So.
Wow, any questions or comments?
Thank you, Marianne.
Thank you.
This is good stuff. Thank you. I'm glad we're addressing that on an accelerated track, too. Thank you, Marianne, very much. That takes us to the agenda item number 10, board members reporting on anything since the last board meeting. Do you have anything?
The only thing I'll report on is the problem out at Yelm with biosolids and the concern that community has. There was a individual came in today to our board meeting and brought 500 signatures with her. I think it goes to show, and I've been at several public meetings out there now, And it is a big concern. I think the Department of Ecology is making a mistake if they issue that certificate to apply biosolids close to the river. And I think we'd be doing ourselves a disservice if that happens. I'll just let it go at that.
Okay, anything? Nope, me neither. Thank you. So that takes us to agenda item number 10, Health Officer's Report. Dr. Rachel Woods in the house.
Thank you, Commissioners. I will keep it brief in the interest of time. We have been collaborating with partners because the governor signed into law House Bill 1638, removing the philosophical exemption for the measles, mumps, and rubella vaccine before school was closing. We wanted to just let our school nurses know and our medical providers know that we are standing by to work with them on this issue, although we're pretty hopeful in the state of Washington that most kids have had their MMRs, so we'll keep you informed on that going forward. I consider that, I'm going to move on to another topic, crisis standards of care in the event of like a worldwide pandemic or a severe earthquake. There may not be enough people to take care of all the medical demand or supplies or medications, and so I try to educate my clinical colleagues on what the state is doing for crisis standards of care. So I gave a talk last week to the family medicine residents at St. Pete's. And Art mentioned the wildfire smoke. Happy to talk further with you gentlemen about that and the inflection points for when we would recommend, say, for example, closing the Mariners game, which doesn't happen to fall in Thurston County, but that's an extreme example of a big impact of wildfire smoke. And I will stop there. Thank you.
All right, questions or comments of the?
No, sir.
With the doctor? No? Okay, the director's report then.
Thank you, Commissioners. I will keep my report brief as well. I want to say thank you again to all of our presenters and staff and community partners who all spoke today, and the amazing work that has been accomplished on both the housing crisis and the opioid crisis. We could not do it without our whole entire community and the Board of Health to make that happen. So I just want to recognize everyone that has supported those efforts and for all the great work that public health does every single day. You had a really broad group of presenters today that really captured the important work we do every day. Just a few messages for the public. On May 28th, our environmental health staff received word of a sewage overflow at South Puget Sound Community College, and subsequently identified high levels of fecal coliform in Percival Creek, as well as Bud Inlet. So we just wanted to continue to warn the public to please avoid the water in those areas. Marianne O'Garro's presentation on health equity also really speaks to the important work that we have to do in our community to address health disparities. Our Child, Family, and Community Wellness Division, specifically our maternal child health program, Bonnie Peterson and Gretchen Toller recently conducted a maternal child health needs assessment for the Department of Health, and highlighted some real opportunities for you as Board of Health and us as a department to focus on. While we did rank number 5 healthiest county in the state of Washington in many areas, we have some real work to do in several key areas of which the board has invested in, and that includes infant mortality, child abuse and neglect, teen suicide, children's mental health, immunization rates, our breastfeeding initiation and continuation rates, our smoking in the 3rd trimester. So while you heard earlier that tobacco use and smoking has decreased and is at an all-time low, it's unfortunately still present in pregnant women. early prenatal care, youth vaping, and housing insecurity are all areas in which Thurston County ranks lower than what the state average is and what the national best practice numbers are. So those are all areas of opportunity that we're going to be continuing to address and explore, and we'll provide further information for you in an upcoming briefing to share more details about that, because it really highlighted how certain groups are more impacted by others in those areas. And finally, I just want to say our disease control and prevention program investigated and followed up on 162 notifiable conditions. And our syringe services staff year to date have collected 605,133 syringes and distributed 1,147 doses of naloxone. You heard earlier in our homeless coordinators report the year to date data from June to June, so in the last year, exact year. This is just year to date from January 1st to present. So I wanted to share that and answer any questions that you may have for us.
Yes.
The Percival Landing spill.
Percival Creek?
Percival Creek, that's it, you got it. How much effluent was spilled and over how long of a period of time did that go on before it was discovered?
And may I add to that, because that was going to be my question, and can we attribute the fecal chloroform down around the Bud Inlet, can we attribute that just to SPSEC, or could it be combined with the encampments, homeless encampments down there?
Art Starry, our Environmental Health Division Director, is coming to the podium to help answer that question.
Unfairly.
This is Art, again, with Environmental Health. The exact time that the spill started is unknown. It was identified Tuesday morning. It was after the long weekend, and then they recognized that stuff was going on. So it might have been, I don't think it was going on at the end of the prior week, but it might have been, it was a result of a construction accident where they accidentally blocked a sewer line when they were doing construction on abandoning a line and trying to block that off. Well, they accidentally blocked off the active line, which caused sewage to bubble out over a manhole and into the creek and whatnot. So, it probably at least a couple of days, but whether it was 2 days or 5 days, we don't know. At least not at this point. The bad news is that was the sewer line that was blocked has the capacity of putting out something like 200,000 gallons a day. So it could have been quite a bit. We don't know the exact volume, but it was quite a bit. So the sampling that we did showed that there were elevated bacteria levels in Percival Creek on the campus, and they declined some as it went actually through the valley. And then after the overflow was stopped and we sampled again at the end of the week, the levels declined. They were still elevated up on the campus, but then they declined as the water got through the creek. So not at healthy levels, but much lower than they were. And that's probably a combination of the sewage overflow, plus there are activities within the valley that might have been contributing to those as well, because there's homeless encampments and things. The marine water quality problems, they were kind of limited to the southern portion of Bud Inlet. And so as far as the fecal coliform are concerned, so when we sampled actually out at West Bay Marina and the park that's over there, the levels were low. And so that's a combination of dilution and die-off. We're in good shape there. So that was the good news. But the Percival embayment and stuff, the levels were still a little bit high. We've got more sample results pending. I don't have them with me at the moment. I don't know the results. So probably more than you wanted to know, but you asked.
Yeah, more?
Yeah, just a quick follow-up maybe. How many homeless are on that Percival Creek area between, say, the lake and up at the college? How many were affected?
Keely left. She would probably be our best source of information. Yeah. So I'm afraid I don't know that.
I mean, we've suspected there's been an ongoing affluent contributed to that creek because of that even before. So.
Yeah, it makes sense that if you have encampments in that basin that there's an effect. We actually do collect monthly samples. I could bring those in. I just don't have.
I mean, was it really a lot more elevated than?
I don't recall it being like horrible, but it's elevated. I shouldn't actually offer any sort of conjecture. I should get some information for you for the next
Okay.
time.
I will add that the City of Olympia recently installed some portable toilets in that area to help to reduce and mitigate some of the sewage and human waste disposal in the waterways in that area.
Okay, do you have anything? No?
Thank you.
I just have one, not for you.
Thanks, Art.
No, I don't. I already addressed it. Never mind. Thank you. Is there anything for the good of the order? This was an action-packed, very full, meaty BOH. So thank you all very, very much for your contributions.
Thank you so much. And also just to notify the public, we will not have a July Board of Health meeting.
We will not.
So that's 2 meetings worth right there.
Yes, we covered a
Wow.
lot in June.
Okay, thank you all very much. We are adjourned.
Thank you.
Thank you.
Thank you.